Hi, my name is Aziz, and in this particular paper, I present some joint work with Florian and Brandl. Uh, in particular, we're looking at the issue of who gets what and why, and we do so in the context of healthcare rationing, where we want to allocate scarce or costly resources such as ventilators, vaccines, or ICU beds. Making these kind of decisions, especially concerning ICU beds, has been termed as one of the hardest questions doctors have to face. And the idea behind this particular project is to formulate clear rules or algorithms to aid this human decision making. So the same kind of issue also comes out in vaccine rollouts, where not only do we want to identify which groups of people are of higher priority, but we also want to translate these priorities into actual allocation decisions. So, in terms of principles and priorities, people in medical ethics have been thinking deeply about this issue. For example, three principles that are highly prominent are that of equal value for all, getting the most out of resources, and giving priorities to those in need. And more generally, many of these ethical frameworks they are especially keen on taking into account various ethical principles and priorities. So I quote a Deeble Institute report, which states that it's important to acknowledge the various implicit and explicit priorities that influence the process and develop a decision-making tool that incorporates them. So, in terms of priority groups, an allocation mechanism it may want to prioritize healthcare workers or elderly people or the vulnerable people more than the general public. And these kind of priority groups are taken into account while making these allocation decisions. So the question that we want to look at is healthcare rationing while taking into account various ethical principles and priority groups. And this particular problem was considered by a group of market designers who came up with a model for healthcare rationing, a mathematical model. And this model not only captures healthcare rationing, but also various other rationing problems. So let me just quickly mention what the model is. The model consists of a set of agents which can capture a set of patients in the context of healthcare rationing. It could capture a set of students in the context of school choice and so on. There's also a set of categories which can be viewed as all the homogeneous resources are divided into these categories, and each particular category has a certain number of reserve units. Each category C also has a priority ordering that not only specifies the ranking of priorities over these agent set, but it also specifies which particular agents are eligible for that particular category. For example, a category which pertains to elderly people might find young people to be ineligible and elderly people to be eligible. So these market designers they took a matching-based approach to healthcare rationing, where you can view it, the model as a bipartite graph, where you have agents or patients on one side. So you have agents one, two, three on one side, and you have categories on the other side. Each category has a certain number of units associated with it. For example, in this example, C1 has 1 unit and C2 has 1 unit as well. And both of these categories also have their corresponding priority ordering, which specifies their ranking over the agent set. And it also specifies which agents are eligible. For example, 2 and 3 are higher in the priority ranking of C1 than the empty set notation, which signifies that 2 and 3 are eligible for category C1. This eligibility information can also be captured in these edges in the graph, where, for example, agent 2 has an edge to C1 because agent 2 is eligible for C1. So, if you look at this two-sided formulation, one side has priorities over the other side, but if we also artificially induce preferences of agents over categories, we can simply run the deferred acceptance algorithm for this problem. And the first observation that Patrick et al. Had was that, in fact, the outcomes of deferred acceptance with respect to various type breakings, in fact, characterizes outcomes that satisfies three basic properties, and these properties include eligibility of compliance with eligibility requirements, respect of priorities of the categories, which states that the situation in the middle of the slide does not arise, where agent I has a higher priority than agent J for category C, but it's unmatched, whereas agent J is matched to category C. And finally, this deferred acceptance algorithm which satisfies non-wastefulness, which means that no unit should be unused, especially if it can be used by some eligible patient. So When Pathak et al. Presented their deferred acceptance formulation, they also presented another rule which they refer to as smart reserves. And one reason why this particular rule is called smart reserves is because it smartly makes choices about which category an agent should utilize in order to ensure that we find a maximum size matching of the underlying eligibility graph. So, just to summarize among the approaches of Pathak et al., whereas the deferred acceptance rule, it handles heterogeneous priorities, it does not find a maximum size matching. On the other hand, the smart reserves rule, it does not handle heterogeneous priorities because it assumes that the priorities satisfy certain consistency requirements, but it does find a matching of maximum size. So starting point for this particular paper is that we want to look at healthcare rationing problems with heterogeneous priorities, and we want to find allocation mechanisms that satisfy desirable axiomatic properties. So in particular, we also want to focus on some strategic properties, in particular strategic proofness, which requires that no agent should be incentivized to lower their priority in any of the category priorities or to hide their eligibility for a certain category. Secondly, a weaker form of strategic proofness is that of privilege monotonicity, which simply requires that no agent should be incentivized to hide their eligibility. So our main contribution is that we find or we design rules that satisfy various axiomatic properties that have been mentioned in the previous slides, such as eligibility requirement compliance, respect to priorities, maximum size property, non-wastefulness, strategy proofness, and polynomial time computability. So in fact, we present two different rules which satisfy these axioms, and one of our rules, it characterizes the first three properties on this slide. So, in terms of related work, there is a lot of work which is relevant, especially around affirmative action, matching under diversity, matching with distribution constraints. So, I've mentioned some of these works here, but a more detailed and exhaustive list of references is in our reference list in our paper. So, our algorithms, they use or make use of a baseline ordering, which can be viewed as a priority list over the general public. It can be viewed as a fixed priority list over the general public. It could also be based on a randomly generated ordering over the agent set. The main thing to note is that this particular ordering is used to make certain decisions by the algorithm, but it does not override the priorities that the categories have over the agent set. So our first rule in this regard is called the weighted reservation graph rule, and the reason it's called this for this name is that it's based on a weighted reservation graph. So we take the underlying eligibility or reservation graph and we overlay it with certain information of weights on the edge set. So the edges are the same as those pertaining to the eligibility requirements. So you have an edge I, comma C if agent I is eligible for category C, but this particular edge has certain weight which is based on various information. So in particular, it always has a component of weight 1 the moment an edge is a real eligible edge. Secondly, there's a weight component which is based on how high agent I is in the priority list of category C. And finally, there's a minor weight contribution which is based on how high agent I is in the priority list of the baseline ordering. So by setting up the weights like this, what we do is we simply find a maximum weight matching of this weighted reservation graph, and that is essentially our weighted reservation graph rule. This particular rule, in fact, is implicitly doing three levels of optimization, where it first cares about finding a maximum size matching, secondly, wants to credit those agents who are higher in the priority list of categories, and finally, it also, as a third consideration, prioritizes those particular agents who are higher in the baseline ordering. So this rule satisfies desirable properties, and these properties are summarized in this table. What you notice is that WRG, it handles heterogeneous priorities, and it also satisfies strategy proofness and maximum size property and various other axiomatic properties. One particular disadvantage of WRG is that it relies on finding a maximum weight matching of an underlying bipartite graph, and secondly, it does not characterize outcomes with respect to some of these axiomatic properties. So we present another rule now, which does not require us to find a maximum weight matching. And secondly, it characterizes outcomes that satisfy three of the key axiomatic properties that are on this slide. So this particular rule is called the reverse rejecting rule. And reverse rejecting rule, it works a bit differently from the weighted reservation graph rule, or for that matter, for many of the rules in the literature. So in contrast to selecting agents or simultaneously or iteratively, it employs a different methodology where we use the baseline ordering but in the reverse direction. And instead of selecting agents, we try to remove agents in the reverse order and to add them to the rejection set. So we only stop when we can't reject any more agents, and each time we reject agent, we only do so if we do not compromise on the maximum size property. So at a higher level, what we do is we start off with a reservation or eligibility graph, and we gradually modify this eligibility or reservation graph by deleting certain edges or vertices from the graph. So this will become clearer with the help of an example. Here we have an example where you have four agents, 1, 2, 3, 4. You have two categories, C1 and C2, and each of these categories has exactly 1 unit of medical resource. Both categories have different priority lists. Category C1 has priority list which is 1, 4, and 2, whereas category 2, it only has agent 1 and 3 as eligible agents, and agent 1 is of higher priority than agent 3. The baseline ordering for this particular running example is 1, 2, 3, 4. So based on this information, let us simulate the reverse rejecting rule. So the starting point is that of having the underlying reservation graph, which simply specifies the eligibility requirement of agents to categories. So you only have an edge from an agent to a category if that agent is eligible for the category. So we start off with this graph, and the first thing that we do is we try to remove the last agent in the baseline priority, and this last agent is agent 4. So we remove agent 4 from consideration, and the moment we remove agent 4 from consideration, we also need to remove certain other edges from consideration as well. And the reason is because we want to make sure that the maximum size matching of the modified graph still satisfies respective priorities. So the reason that we have removed agent 4 from consideration, we also need to make sure that agent 2, which is lower in the priority list of category C1, should not be matched to category C1. And for that reason, the edge 2, comma C1 is also removed from the graph. At this point, what we do is we check whether there exists a maximum size matching of size 2 of this graph, and yes, it does indeed exist. For that reason, agent 4 has been successfully removed from this graph. The next agent that we try to remove from this graph is agent 3, but the moment we try to remove agent 3, we notice that the graph's maximum size matching is now of a lesser size. So we need to reinsert agent 3 back into the graph, and we can try to remove agent 2. And even if we remove agent 2, we still have a matching of size 2. And at this point, what we notice is that we can't remove any other agents. And these agent 1 and 3 are the only agents that need to be matched. And indeed, if 1 is matched to C1 and 3 is matched to C2, we have a matching of size 2. So this is the outcome of the reverse rejecting rule. So just like WRG, what we note is that the reverse rejecting rule satisfies desirable properties. In fact, all the properties that WRG satisfies, the REV rule satisfies as well. And this is again summarized in this table, where we show that the reverse rejecting rule has some favorable properties in contrast to previous rules in the literature. One additional feature of the reverse rejecting rule, which is not satisfied by WRG, is that in fact the reverse rejecting rule, it characterizes all outcomes that satisfy three fundamental properties, which are compliance with eligibility requirements, maximum size among feasible matchings, and thirdly, respect of priorities, if and only if it is a possible outcome of the reverse rejecting rule with respect to some baseline ordering. So what we note here is that reverse rejecting rule, it characterizes all outcomes that satisfy three important properties that have been considered in the literature. So, to conclude, we presented algorithms for healthcare rationing. In fact, in our original EC submission, we only had the WRG rule, whereas later on we realized that the reverse rejecting rule has certain merits as well. In this particular presentation, I only mentioned one characterization result, but we have a few other characterization results as well. Two other observations that I'd like to highlight are that our results extend to two important extensions. That they extend to the case of soft reserves, and also they extend to the case of treating the general category in an asymmetric manner. And finally, I'd like to mention that although our rule was described in the context of healthcare rationing, where we want to allocate medical resources, the same kind of formulation can be used for various other applications, in which case the patients change to certain other agents, and the resources could be some other resources such as jobs, school seats, or certain other resources. So it also applies to algorithmic hiring, immigration, school choice, allocation of marathons, race spots, and public viewing spots. So, with this, I thank you for your attention. And if you have any questions, feel free to email us. We look forward to your feedback. Thank you.